So the biggest unmet need in low-risk MDS is still red blood cell transfusion dependence. We saw earlier this year the approval of Luspatercept in the United States, of Luspatercept for frontline use in transfusion-dependent patients with lower-risk disease, showing superiority over eprex in alleviating red blood cell transfusion dependence. And majority of groups do seem to benefit. It's still unclear whether or not patients without ring sideroblasts benefit in a superior way to Luspatercept, although presented at this meeting was longer-term results that suggest that perhaps there are, even in the non-ring sideroblast patients, longer response durations to Luspatercept than to eprex. But I think another study that was presented yesterday meeting the unmet need of red blood cell transfusion dependence was the study by Moshe Middleman of the MATTERHORN study of Roxadustat. And initially, the press release was it's a negative study, it's dead in the water. But on subgroup analysis that he presented, it did suggest that perhaps the use of Roxadustat may be beneficial to patients who have higher transfusion burden. And they enrolled a lot of patients with very low transfusion burden that you could almost argue weren't really transfusion dependent, and which is why in the placebo arm the results look so good. But in patients that are bona fide, really red cell transfusion dependent, there was a signal of activity, Roxadustat. So I'm hoping that there will be further drug development of that, pursuing that as an option, because we still have a limited repertoire of options for treating. We've got eprex, we've got Luspatercept, we've got Imetelstat, although it's not yet approved, and would have, the more agents we have, and perhaps used in combination, the better our options at eliminating red cell transfusion dependence and keeping red cell transfusion dependence at bay for as long as possible.